anywhere in the midline structure such as the palate, it's always going to be mediolateral extent and superior inferior or anteroposterior extent. Okay? So when you are examining it like this for the labial mucosa, this will be anteroposterior, but if lip is in the resting position, this is the superior portion and the sulcus is going to be the inferior portion. So if you are writing, the first thing in inspection should be number of ulcer. Okay, so if it is a solitary ulcer, it should be one ulcer, or a solitary ulcer should be there. And after that, the site of the ulcer should be mentioned. A solitary ulcer present on the lower labial mucosa, or if it is in the upper labial mucosa, you are going to write on which side of the upper labial mucosa it is going to be present. So on the labial mucosa present, extending mediolaterally from the midline. Imaginary midline will be as the medial extent and lateral extent will be the corner of the lip or the commissure of the lip. Okay? Extending medially 1 cm from the midline to 1 cm from the corner of the lip or commissure of the lip. Okay? And superior inferiorly, this is going to be the vermilion border of the lip, which is going to be written as the superior extent, and the inferior extent should be the lower labial sulcus. Okay? So after extension, you have to write the color of the ulcer. In ulcer, there are 4 things to examine. Floor of the ulcer, okay? The base of the ulcer, which will be done on palpation. Base of the ulcer cannot be seen. So floor, edge and margin of the ulcer are the 3 things that have to be done on inspection. So floor of the ulcer, usually if there is an ulcer present, floor is going to be yellowish in color. So the margin is going to be, you are going to write if it is irregular shaped or if it is going to be well defined, round or oval in shape. If it is going to be round and oval in shape or well defined, it's usually a recurrent after stomatitis adductus. If it is going to be irregularly shaped because of a sharp cusp or any orthodontic bracket that is crossing the ulcer, it is going to be irregular in shape. Okay? So after which the margins of the ulcer are to be examined. Margins are usually erythematous. Okay? So and the edge of the ulcer should be examined. For a traumatic ulcer or for a recurrent after stomatitis or any viral ulcer, the edge is usually sloped. Okay? For a tuberculous ulcer, it is going to be an undermined edge. For a syphilitic ulcer, it is going to be a rolled up edge. So we are going to examine on the inspection of an ulcer, floor, base is on palpation, floor, margin and edge are to be examined. Okay? After which you are examining all these 3 things on ulcer. After which you are going to see if the ulcer is well localized, the size of the ulcer should be written, and if there are any secondary changes, if there is any going to be pus discharge, if there is going to be any bleeding from the ulcer. Okay. On palpation, there are 3 things that you are going to examine: the consistency of the ulcer, tenderness of the ulcer, if it is there, it is going to be present or not. On palpation, if there is ulcer is going to be tender, if it is going to be soft in consistency, and the base of the ulcer. Okay. Induration meaning it is the feeling of firmness, which means if the ulcer is present in this spot, you are going to palpate the base of the ulcer by palpating the sides of the ulcer. So by palpating this, you will see if there is any firmness surrounding the ulcer. Firmness is seen only in 2 conditions: if it is going to be a malignant, chronic, long-standing ulcer, or if it is going to be a traumatic ulcer which heals, then forms, there's another trauma that is inducing the ulcer again, and the ulcer is going on healing. Okay? So when it's healing, it forms an area of keratosis or fibrosis surrounding the ulcer, which on palpation will appear firm. So there are just 2 things wherein there is going to be an indurated case. All other ulcers you are going to write it is a non-indurated case. Okay? So this is for lower labial mucosa. If it is buccal mucosa, you are going to write superior inferior extent, which is going to be the upper buccal sulcus, lower buccal sulcus as the extent, and anteroposterior extent, which is going to be the commissure of the lip to the pterygomandibular artery, which you are going to write. If the ulcer is going to present on the tongue, please pull out your tongue. If it is going to be present on the tongue, you are going to write if it's on the dorsal aspect or if it is going to be on the ventral aspect of the tongue. And your extent is going to be from the tip of the tongue to the circumvallate papilla. And if it is going to be on the lateral border, you are going to write from the midline to the lateral border. If it is going to be on the dorsal surface, you are going to write from the lateral border and from the midline. Where it is going to extend, you are going to write the nearest landmark as your margin or the extent. Okay, keep it aside. If the ulcer is going to be present on the vestibular area, you are going to use labial frenum and buccal frenum as the extent. Anteriorly is going to be the labral frenum, posteriorly may be the buccal frenum or the retromolar pad area, and superiorly you can use occlusal plane or superior buccal sulcus and inferior buccal sulcus as your superior and inferior